Good morning, everybody. My name is Cindy Begley, and I'm one of the school nurses, and I'm here with Sateera Thompsen, who is also one of the school nurses and our school nurse coordinator. And we are going to visit with you today about getting back together again and some healthy tips for all of us to be able to be together and hopefully stay healthy and not come down with any illness. So we're going to go off the screen for a few minutes and we're going to show you some slides. Feel free to ask questions and we will get to those, and then we'll have a demonstration. We'll come back on at the end of the presentation with a demonstration for you. It has been a very long 7.5 months, hasn't it? Everybody has missed everybody else. As the teachers have gathered this week, they've all talked about how they miss being in the buildings with the students. That's their whole purpose. That's all of our purposes, is to support you while you get an education. So your teachers miss you, we miss you, your friends all miss being together, and we want to really try and have everybody back together again. But we need to keep a few things in mind so that we can stay safe throughout this whole year and hopefully stay in school for as long as possible. My alias is Geraldine the Germ Buster. And the elementary kids will know this because we try every year to talk about germs and how we can stay safe from these. And Geraldine says hand washing is the #1 way to get rid of germs, and it still is. You will hear that from the experts, the CDC, the World Health Organization, the Department of Health. We know that hand washing gets rid of germs. If you wash your hands for 20 seconds, which is the equivalent of singing the happy birthday song one time through, it will remove all that surface grime and grease that's on your hands. But if you can't, we want you to use hand sanitizer. And one of the things you're going to see in the buildings this year is hand sanitizer almost every place you go. We want you to use it in between the times that you can't wash, before and after you eat, when you go to the bathroom, if you're touching surfaces, especially for those students that get to go to recess. Lots of cleaning, but we still know that hands are the way that germs are spread in a great big way.
And the second way that we can keep ourselves safe is if we are physically distancing. And so we do call it bubble, there's a bubble space around us. And we're asking everyone to recognize that bubble space, but also step several feet away from even that internal bubble space. So when we say, okay, you step away, physically distance, we're asking people to stay at least 6 feet away from each other. That will help with the decreasing of spreading of the germs when someone is coughing or too close in proximity with everyone. So keep yourselves distanced. It's sometimes hard for little kids to understand how far is 6 feet. And of course, our teachers, your teachers and the staff at your school will help you know that. So when we're socially distancing, some people have said, well, how will I communicate with my teacher? How will I communicate with other kids? And there are some social distancing greetings that we can do even with our masks on. And we've put a few of them here that we'll be going over with little kids as they enter the school. Obviously, there's a lot of there's a lot of verbal cues that people can take from each other, even with their masks on. So here's just a few ideas that we will be sharing with our students.
So what else can we do? Well, we talk in the schools, and especially in the elementary schools, but there's signage all over almost every building about covering our sneezes and coughs with our elbows. So if you can take your arm and wrap it around your nose and mouth when you're sneezing, you are catching those coughs and sneezes, and your hands are staying clean. That's what we're trying to do, is not spread germs through our hands and through our coughs and sneezes. If you need to take off your mask and remove it to cough and sneeze, you go right ahead and do that, and then put your elbow around your face. We want you to hand sanitize, of course, or wash your hands if that happens, because anytime you touch your mask or you sneeze or cough, we still want you to try and protect yourself. If you need to blow your nose, don't use your mask to do it or to wipe your nose off. Take it off, blow your nose, and then guess what? Go hand sanitize again.
Some other healthy tips in general would be drinking plenty of water, getting lots of fluids every day. The one thing you will find at schools is that the normal water fountain has been disabled so that we aren't touching the water fountain with our hands. There is a dispenser where you can put your bottle and it will sense your bottle and then it will fill up the bottle of water. So we are encouraging all kids to bring their own bottle and stay hydrated. Of course, some of the other things, you know, you are what you eat, so healthy fruits and vegetables to your meal. We encourage everyone to get plenty of sleep. The 8 to 10 hours a night will help us fight off germs and help keep us safe. And above all, if you are sick, stay home. We need to take the time to be sick. I know lots of times we are a community of people who think we can tough it out, we can come to school. Let's just this year be really diligent about being sure if we're sick, we stay home.
So this is going to be, because it's going to look so differently this year, we know that kids are going to be down in the dumps even though they're back with their friends, because we are going to have that distancing in place. Classrooms may be spread apart. You're not going to be going to school 5 days a week, at least to start out this year. You will be in the buildings for a couple of days. And so everybody is going to want to use that time to catch up, to learn what they need to learn in their classrooms. And there may be a little bit of stress with this. There has been for the last 7.5 months when people need each other and they need to be around each other. This is really normal. We want you to talk to your parents. We want you to talk to your teacher, to your nurse, to your counselor. Anybody in the building will help you with this. And they can find resources that will sit down and visit with you and help you work through this, because it is real. It's happening with our parents. It's happening with our students. So we know that it's part of us right now. And I know that the counselors did presentations on this and they had some great ideas. So just remember, just a reminder that reach out to the people that are at school to help you get through this, because it is going to be different.
Masks. Why wear them? So we are both feel, and all of our school nurses feel, that masks are our first line of defense for keeping other people safe. So when you cough or you talk loudly or you're forcing anything out of your lungs, the mask is going to help to contain any germs that you might expel. In the COVID world, you might be carrying the COVID virus. You might not get sick. And you know, if you are around other people who are medically fragile or someone who may, if they contract the virus, it would be harder for them to get well. We want everyone wearing masks so that they are protecting other people. And like our slide says, masks will protect your family, your friends, your teachers. And again, we are really looking forward to everyone coming back to school, and we want to be together again, and we want to stay together again. So some of the things that we're discussing, like the mask wearing, the physical distancing, the cleaning, the hand washing, it's all so we can all stay together at school safely.
So what kinds of masks are best? We know that there's lots and lots of them out there, and we will show you some of those at the end of the presentation. But there's some ideal things that you should look for with your masks. Number one, they should fit snugly over your nose and all the way down under your chin. So if you have a mask that only covers your mouth, it's not going to protect you from breathing in germs. And if you breathe in germs through your nose, this COVID virus and other viruses can lodge in your nose, and that is the way that they get into your system. 2 layers are best, at least. 3 layers even better. Some of the masks have little pockets in them that you can put a filter. Filters can be as simple as a folded up coffee filter. They can be a piece of lining that your mom may use to sew with. It's just another layer. Gaiters and bandanas, although they have lots of really fun styles out there, they may not protect you as well as you think they might. And our concern is that you can breathe through these and inhale through these, and the particles that may make you sick will go back and forth in this gaiter and can make your friends sick, they can make you sick, and they may give you a false sense of protection so that you feel like if your nose and mouth are covered, that you're good to go. And that may not always be the case with these. Another mask that really is not the best to have, and you do see them in a lot of places, are masks with valves on the front. So there may be an opening there for when people to breathe out, they can expel their air, and it also keeps the mask from getting so warm. These masks have been proven not to be really protective of somebody who may be standing in front of them, because once again, you are exhaling potentially germs that may have COVID in them, or some of the flu viruses, or a number of other things. So that is another mask that is not really recommended. The school district is going to provide 2 masks for every single student, and these will have adjustable ear loops on them. So parents, when you get them, you may want to help your children with the fit so that it does go over the nose and under the chin, and they get the best fit and the best protection with them.
So there have been a lot of questions around masking and how do I put them on? How will I know that I'm doing it correctly? So we've kind of provided some guidelines. And of course, we always want to wash our hands or use hand sanitizer prior to picking up our mask to put it on. You would want to hold it by the ear loops, slide them over your ears. And then many of the masks have an adjustable strap so that they can be fit snugly around the nose and the mouth and under the chin. So after you've fitted your mask to your face so that it's covering your nose, your mouth, and under your chin, again, we'd want you to wash your hands and wash your hands or hand sanitize. Again, like we had said in the very beginning, hand washing is key. And so we will be encouraging everyone to do it throughout the school year.
So we talked about some of the types of masks, and we're going to show some of these again at the end of the presentation. But some of the masks that are around, but we really won't be seeing them in school, are some masks that medical providers wear that are kind of firm and hard. They're called N95 masks. They are warmer to wear, and we really don't recommend that students have them at school. They should be left for the medical providers. They do offer a lot of protection, but because they get so warm, it's going to be difficult to leave those on.
And we know that there are going to be situations where it's contraindicated for someone to wear a mask. The CDC, South Dakota Department of Health, American Academy of Pediatricians all say if someone is unable to remove their own mask, they are not a good candidate for mask wearing. Kids that are under 2 years of age. And there are some medical reasons why it may be difficult to wear a mask. In that case, we would ask that you visit with your school nurse. We do have a medical waiver that would need to be signed by the parents and by a physician in order for us to allow that. But again, the majority of the people will be able to effectively wear a mask. Masking does not affect our oxygen, and we are not concerned about that as long as we're wearing our appropriate type of mask. The other thing we've tried to incorporate into the day, and we've based this on the CDC guidelines, the South Dakota Department of Health, that we will be helping kids or encouraging kids and teachers to take mask breaks. Sometimes as a healthcare provider, we've become so accustomed and so used to our masks that we forget that everybody isn't as comfortable as around them as we are. So the mask breaks, obviously when kids are at lunch eating, they'll be allowed to have their masks off. When they're outside on the playground, they will be allowed to have their masks off. So we will incorporate some breaks throughout the day. If a child is really struggling with the mask, obviously we will work with those kids individually.
So how do you take it off? Or if you need a break from it, what's the best way to do this? So once again, we want you to wash your hands or sanitize your hands. And then just like you put it on, we want you to hold it by the ear loops to slide it off. Now, every student in the mornings, we're hoping will have a paper towel that is on their desk. And when you take off the mask, you can lay it down on the paper towel with the outside of the mask touching the paper towel so that the inside is facing up. And then hand sanitize again. When you're ready to put it back on, we just reverse those steps. So hand sanitizer, lift up the loops and put it back on, and then sanitize once more. At the end of the day, if you are meeting your parents or they're picking you up, or once you have gotten off the bus, you can take your masks, and it is advisable to wash them every day. But if you have difficulty doing that, or you need to just let it dry out for the day, put it in a paper bag, lay it on some paper to dry out. But again, it is really strongly encouraged to wash these as often as possible, because kids will lick the insides of them. They're going to move them around. They'll be touching them with their fingers. Everybody does that anyway. And so we want to make sure that they're clean, just like your underwear. When you change that every day, we advise you to change your masks too.
So we've had a lot of do's with masks. So some don'ts that we're going to be encouraging around the school is we don't want kids to share masks. We don't want them to wear them on their head or lopped off to one side on their ear. I have seen, people saying, well, I'm wearing my mask, even when they have it around their neck or their head. So of course we will encourage and we will teach and reteach and educate kids on how to effectively wear a mask. We want you to wash them often, of course. Not hanging them around your arm, not pulling them under your chin, not stuffing them in your pocket. The more you wear your mask, the more you will get used to it. So we're really encouraging all staff and students to wear their masks. You will become accustomed to it. Trust me, you will. And it provides an effective it's keeping our friends and our families from potentially contracting the virus from us.
So we just thought we'd put some cute pictures of these puppies in here with the right and the wrong way of wearing masks. And believe me, we've seen adults that have done this too. So holding it under your chin is not an effective way to put it down. If you need to move it, you know, you can lift it up, you can slide it off one side if you need to sneeze or cough or blow your nose. But we just thought the dogs demonstrated great ways of the right way and wrong way to wear them, even though they do look cute with the masks on.
So what if I get sick at school? So for the first line, of course, would be to inform a staff member that you're not feeling well. Your teacher or whomever you're with at that time that you are not feeling well and that you need to go to the nurse. The school district has been amazingly supportive of some of the things that we need to institute this year with COVID. So we have a well area for kids to come to the nurse to, you know, the kids that have bumps, bruises, those kinds of things. And then we also have an ill area. So when a child says that they don't feel well and they're experiencing COVID-like symptoms, we will be asking the teacher to send them with a certain pass to the nurse so that we can put them in what we're calling the waiting room, which is in essence a place that kids will go to wait for someone to pick them up. We're asking the teachers to send their belongings with their kid or with the child who doesn't feel well at that time so we can minimize exposure in the hallways and to other people. So the other thing that has been amazing this year is the school district has given the nurses nursing assistants. So that way we should have, well, obviously we will have twice the amount of coverage in our schools for someone to triage the kiddos with who are symptom. So if the nurse or the health assistant does the assessment on a child and have deemed that they are indeed ill, they will be staged in this waiting area and we will call and have whomever, parent, grandparent, whomever is going to come pick up the kid, they will come to the school, call us, let us know that you are out in the parking lot and we will bring your child to you. We're really trying to minimize the exposure in the school, so that will be our protocol this year.
One other thing, there are so many symptoms of this COVID-like illness. And we know that students have medical conditions that they may experience similar symptoms for their own condition. So headache is on the list of one of the COVID-like symptoms. If we know that your child has migraine headaches or gets frequent headaches, we can use that when we are assessing your student when they come to the office. And they may not be sent home for a headache if we have that medical history on them. Symptoms change all the time. There are still a lot of standard ones. The Department of Health did tell us recently that 33% of children will not have a fever as one of their first symptoms, but will have a cough. Now that is subject to change also because as all viruses go, they mutate and they change and they develop different symptoms. But right now, the predominant thing that they are seeing with many children is a cough. But we want you to know that if you haven't communicated with your nurse for medical issues that your student has, this would be the year to do that. Because by state guidelines, we have to go by their symptoms to determine if they are going to go home. So if we know that there is another cause for that symptom, then we are likely to keep them in school. And we want to do that. We want to be able to do that. But we are mandated by Department of Health as well as best practices on how we're going to manage each student.
So from the parent guardian standpoint, what can you do to help us here at school? Well, some of the biggest things you can do, of course, is be sure that your child feels well enough to come to school, checking their temperature, running through the symptoms of not feeling well in general. Not only the COVID-like symptoms, but any type of symptom that makes your child not feeling well, they should stay home. So if we could get parents to do that every day, get a quick assessment of their kids, that would be great. The other thing that's really helpful is having current phone numbers. And we know that phone numbers change frequently. So we're just really asking if everyone could please keep the school up to date on their current phone number. It really expedites our time in getting the child back to you when they're not feeling well.
So your nurse might look a little bit different this year. They will always, I would say 98% of the time, always have a mask on, but they'll take it off so that you can see what they really look like too. They might be in a gown and they might have on goggles or some kind of eyewear protection and maybe even gloves. We have face shields that you may see also at times in the building. So we might look like we are coming from a zombie movie. But this is just protection, and this is guidelines again by the Department of Health. Don't let us scare you. Just still come with whatever needs you have. We are not going to be in this kind of gear all the time, but we do want you to know that we will be dressing a little bit differently this year at times.
Okay, so as always, if there are some questions that we do not cover today or that maybe you think of as soon as this presentation is over, please remember you can always contact your school. You can ask to speak with your school nurse or your school health assistant. We are more than happy to try to help you with your questions, concerns, thoughts. This pretty much concludes our presentation. However, we do have a short little visual. So I'm going to stop this video feed and put us on live. So bear with me while I do that.
So I told you that we would talk about masks right now and the different kinds of masks. So I have on one of the gaiters, and these you see all over the place. They're pretty loose at the bottom. They do fit snugly over the nose. A couple other styles, looks like some kind of turban type scarves. But I want to show you what these do when you put up a candle to it. We talked about the loose weave on clothes and how double layers are much more effective in reducing that transmission. Candle goes out. I'm going to relight it again, and Sateera and I are going to show you some other things. So that is one of the gaiters. Again, the masks go out pretty quickly. The mask that I had on is a double layer. This one does have a little pocket in it that you could actually put a third layer if you wanted. And these paper masks, and you can buy these at Sam's, I know because I just saw boxes of them over there, are still effective and they work pretty much the same way. But if I put on this mask and try and blow this candle out, you can see that that is still a barrier and the candle is still lit. mask that we may have, that you may see, and these are the ones that we said really we don't want kids to wear. These are called N95 masks. They're very stiff and rigid, and you can't blow through them, but they don't breathe, they don't allow any air movement at all. And so these should be reserved for medical personnel. Okay, so Tara's going to show you.
So this is a idea of how a nurse could look if we really feel that someone is presenting COVID-like symptoms. An N95 mask, some sort of goggles, a face shield, and a gown. Because again, we need to protect our nursing staff to the point that they can always remain at school to help kiddos. So again, we know that this might look a little different for some of our kids, but we will make every attempt to make them as comfortable as we can.
So this concludes our presentation. We'd be happy to answer any questions that you have. You can always contact your school nurse at the school that your student is going to. If there are specific scenarios, if there are things that we can't answer, you don't want to answer in this chat box, we understand that, and we are happy, and all the nurses are, to visit with you.
The things that we're going to be encouraging at school is physically distancing, staying at least 6 feet away from each other, wearing a mask, hand sanitizing, screening your student prior to coming to school, and hopefully we'll all stay together and we'll be prepared for a great year. So I can't wait to see everyone. Thank you.
Bye-bye.